All of us probably fear that at one day, at one time or another, we may end up sick enough to have to see a doctor. But how do we know that that doctor that we may be entrusting our very lives to is going to be competent? I mean, is the clinic or the hospital going to deliver the adequate care that we need? Today's show is about how you and your family can protect yourselves against a hospital horror. Just a kind of nightmare you're going to hear from some families who are joining us today on Rolonda. Walk into a doctor's office and you read the plaques on the wall. You might see the doctor's license, his education and certification status. But none of these things really tells us how good or bad a doctor really is in his performance. Headline after headline these days is telling us of thousands of people who die each year, all because of the negligence of doctors and hospitals. Later in the show, consumer advocate Ralph Nader is going to join us live from Capitol Hill to give us some good guidelines on how to select the best health care providers. He's also going to warn us about what we should look for in order to avoid disaster for ourselves or our families. I mean, just imagine this, taking your precious 7-year-old daughter to the hospital for a routine tonsillectomy. She's wheeled into the operating room and you wait and you think about all the ice cream that you promised her that she's going to have. But it's a promise you can never keep because your 7-year-old daughter never makes it out of that operating room. That is the painful story of my first guest. This is Betty Keeling. Thanks for joining us. Betty, what happened? What is the story of your daughter? She had a tonsil problem.
Yeah, and she just got a recurrent fever, so I took her to the pediatrician, and then I took her to a specialist, on ear, nose, and throat. And, we had an appointment. We brought her in. He checked around, and he decided that the tonsils should come out because they were in very bad condition. And he said to me, do you have a preference in a hospital? And I said, no. I said, you're the doctor. And he says, well, there is a hospital right around the corner from me. It's a physician's hospital. It's close and convenient. And it's a very good hospital. And I said, you're sure? You checked it out? Everything is going to be okay? Mm-hmm. He says, yeah, everything will be fine. He said, it'll be something very simple, the routine tonsillectomy, mm-hmm. In and out procedure. They took Cindy into the operating room, and they said that she would be right out, no longer than a half an hour, Mm-hmm. And time went by, and I asked questions from the OR.
How much time went by?
About an hour, half an hour, then an hour and a half, and then I kept hearing things. Code blue, and I kept asking questions, and nobody wanted to answer me. They kept saying to me, oh, miss, go and sit in the room. Everything is going to be all right.
They knew that you were
I
the
was
mother.
I was just apprehensive, just like everybody else. You're always concerned of what's happening. So I went over there, and I asked, and they still would not answer me. Mm-hmm. So after a while, when they called the code blue, my husband and myself, we went over to the elevator, and we saw that somebody was coming out of the elevator with some sort of paddle machine. And then she addressed the other person. She went through the double door. When she came out, she says, oh, it's already too late. So I went back into the room and sat with my husband, and my husband says to me, it could be for somebody else, Betty, don't worry, So we sat there and we waited, and the surgeon came out, and he was full of blood. All of the greens was full of blood. And he said to us, just like that, he was standing on the door, and he said to my husband, I don't know if she's dead or alive. And then I heard him, and my husband says, what do you mean? He says, well, I got to go back inside and check and see if she's, how is she doing? So he came back out later on, about an hour later, and he said that there was a little bit of something wrong with her, that, they have to check her out, but that the facilities weren't good enough, so that they would prefer to send her, to transfer her to a better equipped hospital where they could do further studies. So they took her into Long Island, Long Island Jewish Hospital.
What
and,
condition is she in at this point?
well, they would not say.
They wouldn't let you see her?
No, they didn't let me see the baby until some kind nurse from the transferring hospital came in and said, Mrs. Keeling, has anybody bothered to let you see your baby? And I said, no, nobody has bothered to let me see her. He says, would you like to see her? And I said, would you let me in? And that's when they took me into the into that room where they had her.
And what did you see?
I saw my daughter with some sort of like a respiratory bag or something over her mouth, and they kept helping her breathe with this thing. And I looked at her and I felt that she was warm, but you knew she wasn't there any longer. And then when I just touched her, she didn't answer me, and I asked her in Spanish, Mommy, wake up. Mommy, please wake up. And she wasn't waking up. So that was it. They just transfer her. And then little by little, the nightmare began. When we got to the other hospital, a doctor there that was in the intensive care unit said to me, something criminal has been done to this child. He says, where were they for the 25 minutes that there is no time unaccounted on these records? Where were they? Were the doctors there?
What did you find out had happened?
Okay, there was a statement of deficiency issued on the hospital, and so many horrible things have been done. One of them is that there were no monitors on Cindy at all during the surgery.
To tell if there would be an emergency situation in the middle of the operation?
In the middle of the operating room. There was no something called a precordial stethoscope. That's the stethoscope that a doctor is supposed to use to monitor your heartbeat and your respirations. There was no carbon monoxide machine, and also the most important thing is that Cindy had heart arrest, cardiac arrest at 11:05. And no CPR was given until 25 minutes later. So both doctors just stood there without even bothering to do a cardiopulmonary resuscitation.
What has this done for your life and the life of your entire family?
It doesn't end. It just, you keep going on, and you keep praying that everything is gonna be all right, and you're going to try to help other people by changing laws, and maybe this way, my daughter can see that I'm doing something good for her. And my 4 sons, they don't know what happened. They always ask, why did this have to happen to us? And what about my husband? I mean, I have 4 sons, and then I had a beautiful little girl. And now I don't have no little girl to say, Daddy, I love you, and Mommy, I love you. And I have to live like that forever.
You are trying your hardest to help other families, other mothers and fathers, other families not go through this difficult time. And I know, Joyce, that you have a tough story to tell too.
Yes, I do.
We're going to save some families today. We'll be right back in just a minute. What can make a child grow up to be a killer? We'll hear from Jeffrey Dahmer's parents on the next Rolonda. What do you do if you find yourself having to be rushed to a hospital, you find yourself sick enough to need a doctor, you find someone you love or a family member having to be a part of the medical institution, you're depending upon medical help? How do you know that the doctor you're getting will truly help you, will save your life, is competent? We've heard such a devastating story. I'm so sorry. Betty has been telling us about losing her 7-year-old daughter who went in for a simple tonsillectomy. This hospital that this doctor chose You found out some other things about this hospital after you did your research that were some pretty alarming things.
Yeah.
Can you share that with us?
When you go into a hospital, there is no signs to warn you about anything. The hospital at the time that Cindy went in was on probation. That means that the hospital had been warned about all the substandard care that they had given to other patients. There is no way for you guys to find out any about this stuff. After Cindy died, it took me a while, but they lost their accreditation. The hospital closed down 10 months later after my daughter died.
The thing about it is that when we find ourselves in need of a doctor or a hospital in that situation, we're in such desperate, I mean, we're not thinking right. We're not, we're just trying to think of the doctor, put your life in the doctor. But we have to be aware. We have to ask questions. We have to save ourselves and our children and our families. Joyce Palso says that she's lucky to be here today. You're lucky to be alive sharing your story with us. Joyce says that after a botched tummy tuck operation, her family had to make one of the toughest decisions ever. What were they going through?
They were going through the loss of their father a year prior to this, and my son bought up a cemetery plot from me, and my daughter was told by the hospital staff to call my family and tell them I would not live. The difference in my story is that I was very, very healthy when I went in because I chose to have a tummy tuck done.
Mm-hmm. Now this is like cosmetic surgery that we hear so much about.
Right. I interviewed 3 doctors, and they had to fit me into my schedule because I owned a business at the time. Mm-hmm. And I chose one who could fit me into my schedule. And I called Sacramento to check on him, and they said they had nothing on him. When in fact they had 11 lawsuits on him and had been trying to get his license away 2 years prior to my calling.
Why couldn't they tell you that? I mean, here's a lady who's making the right step.
That's exactly the question that I asked when they came to see me. I said, why couldn't you tell me? Well, now we get into the legal system.
Right.
Because innocent until proven guilty, and none of the cases had gone to trial. So.
And did you find that doctors were covering for each other?
Oh,
and
certainly.
Hospitals were covering for a clinic, and
no
everybody's
doctor wants to testify against a doctor,
Sure.
another doctor. Then I called AMA in Chicago, and they said he was a member in good standing.
At the American Medical Association?
American Medical Association. Mm-hmm. All it means is he'd paid his dues.
So what happened in this tummy tuck operation that ended up almost to death? I mean, your family had started planning your funeral.
Actually, examined by other doctors later, the doctor didn't do anything right. He had no training in it. None. Zilch. And so the incision popped open and became very, very infected with 3 infections, and he would not refer me to anyone else. And then I found out later because, number 1, he wasn't on the staff of any hospital, and number 2, because he had so many lawsuits already against him, he was afraid.
Joyce, how'd you end up with a doctor like that? I mean, how did you...
Here, I checked him out with AMA and checked him out with California Board. I don't know. I'd like to be able to answer that question. The infection got totally out of hand, and I ended up in a hospital emergency. Mm-hmm. And that's where they told my daughter to call my family.
Because one of the questions that we're going to raise in the show today is, don't y'all think that there should be a central database that before you go into an operation, or you have your child go in to see a doctor, that you can check on a computer and find out if there's anything wrong with them? Well, there is one, but you can't access it as the public. And what is interesting to me, too, is how you ladies have taken such tremendous pain in your lives and turned it around to let us know things. What else would you let us know so that we can avoid this for our families?
Well, me, myself, I think that everybody should address their congressmen and their senators. With this new health care reform that they want to pass, you should write to them. You should tell them, include in that package some patients' rights, because we all have rights to know everything. Mm-hmm. There is things that we don't know, and what is important here that a lot of bad doctors are still practicing, and what they have is as a license to kill. So you have to be aware. Please just keep doing something so that we have access to this information. The data bank should be open to all of us.
I mean, many of us do believe that we should have the right to know if a hospital or a doctor has a blemished record. There are those who say that we don't have that right. There are actually people who believe that it's none of our business to know if a hospital or a doctor we'd like to use has some kind of a damaged record. We're going to have that debate when we return. We're also going to be joined by Mr. Consumer Rights himself, Ralph Nader, who has some excellent tips on how families can protect themselves against horror stories that come out of hospitals. We'll be right back. About certainly not bashing every hospital and every doctor. Goodness knows there's some brilliant people in the medical field out there. But we cannot ignore that 100,000 people a year die because of medical mishaps. And we've been hearing some horrific stories of near-death situations, in your case, Joyce, and having lost a 7-year-old daughter, in your case, Betty. Questions have been arising from the audience. I think people are really riveted by this story, as I'm sure you are, concerned about your own family and yourself.
Yes, especially my daughter. I just had a 4-year-old who had tubes put in, and I was really scared. It was a 10-minute procedure, but it was really scary. My question is for Betty. I'm really sorry about your loss. I understand. My question is, although the hospital closed down, whatever happened to these physicians? Did they lose their license? I mean, because it was their responsibility. Are they out practicing medicine?
Sure are.
Oh, come on, Betty.
Yeah.
Betty, tell us what happened. Thank you so much. What is the step? I'm sure you took some type of legal action, and what was the response?
Okay. First of all, you have to take a legal action, and then what happens is that you hire the attorney and you go through all of the, finding procedures and everything. But the most important thing here is that Cindy's case was automatically transferred to a place called the Office Professional of Medical Conduct, where all doctors are supposed to be investigated. Cindy's been dead now 5 years, and nobody from that office has ever contacted us. We haven't heard anything. They're still practicing. Nothing has ever happened to them.
That's not fair. I mean, how does that? How can they get away with that, though? If that's
well, for a fact, you know that doctors are rarely disciplined. I mean, that's something that all of you as New Yorkers, you know that you see it all in the media going on. They're rarely disciplined. They go from state to state. They lose their license in one state, and then they just move on to the next one, and then they butcher somebody else in the next one.
Question here.
Yeah, it's more of a statement, really. I think maybe that it would be a good idea, don't you think, to have maybe a family member, if they want to observe an operation from a distance. This way, I think your daughter would still be alive then.
Yes. I agree totally with you. My husband, at the very beginning when we lost Cindy, my husband suggested once that maybe all surgeries should be taped. Maybe that way we would find out where the doctors were.
I see a lot of agreements out here. Is that what you believe? I know that before we had gotten into the issue of this data bank, there should be some place, people believe, as many of us we've gotten so concerned at this point, that many of us are pushing for a national data bank where you can actually check to see if anybody in the medical field has a blemished record or not. There is one now, as we mentioned earlier. It is not accessible to the public. Jim Martin, our next guest, says it shouldn't be. He's an attorney who represents doctors in malpractice suits. He's also a former board member of the American Medical Association. Also joining us now is live, coming to us from Capitol Hill, is consumer advocate Ralph Nader. Thanks for joining us, Ralph, from Washington.
Thank you, Rolonda.
Before we get to you, Ralph, because I know you have some wonderful tips for families, things that we should look out for before we get to a position where we're so desperate in a medical situation. Jim, let's deal with you. How can you say that it's not our business, that we shouldn't be able to have access to a data bank that could possibly save a life?
Well, I don't know that the data bank does that to the individual.
You see, most people misunderstand what medical malpractice is about. First, it really isn't about medicine and it isn't about law. It takes three things to have a medical malpractice case. The first is an untoward result. For example, I go to a plastic surgeon and I say, make me look like Robert Redford. And I take the picture and the surgeon does the job absolutely wonderfully. That is, he does all of the suturing, he does all of the manipulation that needs to be done, but I come out looking like this. I have no infections, I'm perfectly healed, but I'm not Robert Redford. I had an untoward result. The second element in every medical malpractice case is what I call the cool hand Luke syndrome. All of you remember the movie that Robert Redford starred in many years ago? The byline, the word in that movie, the line, was, what we have here is a failure of communication. Right? Remember that? Well, I heard some of that here today. And that's what happens. How many of you talk to your physician?
Wait a minute. Whoa. A failure to communicate, this, what I heard in Betty's story, was to tell her that her 7-year-old was in cardiac arrest.
Yes, but to explain why the baby was in cardiac arrest. And what happens, most of you, if you've called your physician's office, will end up speaking with either the nurse or receptionist, and you don't get a response. You say, what happened here? And the response is, gee, we can't talk to you. There is a failure of communication. That brings into the third element. And the third element is the medical record. Medical records are alive, believe it or not. I mean, they actually are breathing things. And there really isn't a medical record around today that you cannot find something in it that is not exactly dotted an I or T crossed.
So what your fear is that with a data bank, that one little glitch will turn into a doctor losing his whole profession?
Well, it may very well be that, because what the data bank records is medical malpractice settlements or payments. That's what it records. It does not take care of competency of physicians.
Question here from the audience.
I don't know. I think it's ridiculous. I think we should be aware. We should know the doctors that did this to her daughter. It shouldn't be hidden. I mean, it makes no sense.
Because let me tell you something. The doctor who operated on your daughter could operate on your daughter next week or your mother next year. Yes.
I just wanted to say that then the city that we live in
Where's that?
is in Port Richey, Florida. It's published in the announcement section of the newspaper which doctors have current lawsuits.
Question here. Come on over here. And while I do, come on, let me grab you right now. Yeah.
She's talking about publishing in Florida. What if you were to take out an ad in a newspaper here in New York, letting people know who these doctors are? I mean, can she be brought up on suit for that? Is there some kind of legal grounds that, prevents her from doing that?
Obviously, there's a question whether there's libel or slander, but truth, I've been told, is the ultimate defense in those matters. Yes, she could do that if that's what she wanted to do. But lawsuits, the notification of lawsuits are generally published in most local papers. I don't know what they do here in New York City or who reads about it here in New York City, but the word about a doctor generally gets out, particularly in smaller communities.
There are different ways to find good doctors, good hospitals, places where you feel confident to find out. Ralph Nader is joining us live from Capitol Hill. Ralph, we've got to take a break and we're going to come back to you. And let me ask you this question, ladies. What if your gynecologist gave you an unwanted surgical procedure to hide a mistake? I also want to know how to select the right doctor. We said we'll get back to Ralph Nader. More things, too, about getting more out of your health insurance and all these types of things. We'll continue this conversation right after this. Mr. Consumer Rights himself. Ralph Nader for years has been standing up for the rights of consumers, and he's joining us now live from Capitol Hill to talk about how we, Ralph, as families and just the average Joe Schmo, how can we protect ourselves when we find ourselves in need of a doctor or a medical institution so we don't end up in such horrific type stories that we've heard today?
We've got to be more assertive You simply cannot go to doctors and say, doctor, hospital, I'm yours, take me.
But we do that, Ralph. I mean, how many of us, I mean, we don't even call our doctors by their first names.
Well,
You know, we're just entrusted to them like they're demigods.
well, that's what this book, and there'll be a address on the screen for those who want to write for it. It's not in the bookstore. It's coming up in a few minutes. It's like anything else, Rolanda. You want to know how to cook, it's a pretty good idea to have a cookbook. Want to know how to repair your plumbing or your electricity at home, you have a repair book.
Okay,
But when
so
it
we've
comes-
got more than a book now, Ralph. We've got you. Tell us
Right.
some things that we as potential patients, let's say we find that we have to go in for some simple surgery. What are the first top 3 questions that every potential patient should have?
Well, first of all, you have to ask, you have to interview the surgeons, and don't just interview one. You get names from your friends, from other doctors, from medical schools. You narrow it down to a number of surgeons. Then you check out their references. There are places in libraries where you can see where they went to medical school, what hospitals they were in, what specialties. Then you interview them. Doctors who don't want to be interviewed by potential patients, stay away from them.
That's right.
And then you ask them certain questions. For example, can I talk to the anesthesiologist before the surgery?
Right.
See, that's one. Will you let me decide? Will you give me the opportunity to decide, even though you're the expert? I'm the one who's going to have to decide. Will you give me your medical records? Ask questions about what kind of assistance the doctor is going to have. If the doctor is sick that day, who is going to replace the
That's
doctor?
an excellent question. I mean, how many of us think to ask that? Suppose you get sick. Who's going to take care of me on that operating day? Let me ask you this also. What do you think, Ralph, about this opposition to this national database?
Well, I think it's wrong, because there was a doctor in Texas whose specialty was unnecessary neck and spinal injuries and surgery. He'd do unnecessary surgery. He was thrown out of 12 hospitals in Texas, picked up his practice, and went to New York and opened up. Now there should be a central data bank, and there is. However, it's closed to everyone but state officials and hospitals. You can't get it. I can't get at it. Doctors can't even get at it. There's a bill now in Congress as part of the health insurance package. This is a critical summer, Rolanda, for people to call and write their members of Congress. There's a bill that would open up the National Practitioners Data Bank, that would beef up the state disciplining boards for doctors. Only 300 doctors last year were disciplined for negligence or harming people out of 600,000 practicing physicians. And we know that 5 to 10% of all physicians are either incompetent or addicted or otherwise incapacitated to practice medicine.
That is frightening.
How about this one?
What do we do? Do we write our congressman? Do we call someplace?
Yes, you contact your representative and your 2 senators, and you say, we want measures to prevent malpractice. We do not want measures to restrict the rights of victims and their next of kin, as you've seen today on your program, from having their full day in court. There are more people killed in hospitals from medical malpractice than the total death toll from homicides, fire, and motor vehicles in this country.
And you know how many bodies we've seen there.
And
Absolutely.
that doesn't even count the Medicaid mills and the clinics just in hospitals. According to the best study ever done on malpractice, the Harvard School of Public Health study. And the doctors who did that study says it's costing us $60 billion a year because of medical and hospital malpractice violence.
And it's costing us lives because nothing's being done about it.
And hundreds of thousands of injuries.
Okay,
Far more than...
Ralph, we've got to take a break. You're giving some great information. We'll continue with this and speak with another couple who went through another horrific story in a hospital. We'll also continue with you. We'll be right back. It's hard to believe that a story could be even as bad as some of the ones that we've already been hearing, but imagine this one. Your gynecologist gives you an abortion, but does not tell you that you were pregnant to begin with. Believe it or not, that happened to our next guest, Mary and Tom Miller. You had been longing to have a child for a while when you went into this doctor.
Right. I'd been an infertility patient for approximately 6 years.
Oh, gosh.
This doctor, I have to say, first off, that he used to hold a license as an OBGYN in the state of New York. Mm-hmm. And the license was revoked, and I'm going to guesstimate 1989 for 12 cases of gross negligence.
12 cases.
He came to Connecticut. He also held a license in Connecticut. When he worked here in New York, he used to work in Danbury also at an abortion clinic. Mm-hmm. So he held a license in both states. After losing his license in New York, he came to Connecticut, to the town that we live in.
So I understand that you actually thought that you had a urinary tract infection and you went to go see the doctor.
Right. He examined me. He found a cervical polyp. He said he wanted to schedule another session to go in and have the polyp removed, and he wanted to do an endometrial biopsy. I went in and had the biopsy done, had the polyp removed. He called me back 10 days later. He had gotten the reports from the biopsy back stating products of conception. Mm-hmm. He didn't tell me that. What he told me was I had to go into the office to have blood work done. My estrogen level was elevated, but that it wasn't anything to be concerned about.
But Mary, how did you, wait a minute, the word had gotten back to you that this was possibly a baby that was starting.
Oh, not yet.
At the very, very end of the whole thing.
Not yet.
Yeah.
I didn't know any of this. Up to this point, all I knew was that he had done the endometrial biopsy on me, and he needed to do blood work because my estrogen level was elevated.
Mm-hmm.
And what, in fact, he was doing at that point was a pregnancy test, which is something he neglected to do when he started.
Mm-hmm. But I didn't know that it was a pregnancy test. He never told me that. Called me back into his office the next day and said that he had to do another procedure on me, very similar to the endometrial biopsy. When the procedure was over, it was extremely painful. When the procedure was over, I asked him what it was exactly that he had done, and he told me he had done a mini D&C. At that point, I still didn't know that there was a problem. The next night, which was a Saturday night, I was brought into the emergency room of our local hospital, hemorrhaging, and it was there that the emergency room doctor came in and told me, "Well, you're pregnant." And my initial response was, I can't be. I just can't be. I had a D&C yesterday. The doctor would have never done this if he would have known I was pregnant. I went into the hospital the following day and had an ultrasound which proved that the pregnancy had been terminated. Mm-hmm. The following Monday, I went to see this doctor and ask him. I still didn't believe that he knew I had been pregnant. Mm-hmm. I went into his office, and his words to me were, "I knew you were between 5 and 6 weeks pregnant, but I didn't think the pregnancy was viable, so I didn't tell you."
What? This is a woman who had been waiting for 6 years with her husband to have a child. Tom, that must have torn you to pieces.
Well, we worked really closely with the doctor whose place he took, and we had a measure of trust in him, and we had several dialogues about what our options were about adoption, and if the end of the road were we couldn't have children, what the avenues were for us. Mm-hmm. We thought he had a decision in who took over his practice. We thought he was part of that, and that we could trust whomever came in. And we realize now that it was a business decision. He had a client list. He was unable to work. Mm-hmm. And all he was really looking for, I believe, was, again, someone to take over the practice and someone to come into our town, and we had no way of knowing or no way of finding out anything. But Betty did bring up a point earlier that doctors don't testify against doctors. We had two, the chief of staff at our local hospital and the head of the OBGYN department, testified in Hartford at his medical license hearing. The state moved to yank his license, and they did come forward and testify, and he lost his license 6 months after this.
He did. Good. I'd also like to know when we come back how you have continued with your lives. What has this meant for you, and some words of wisdom that you would share with us? We'll be right back after this. We continue, Mary and Tom. I wanted to know how you resolved this whole situation. You did get that doctor to lose his license.
Yes, we did. I think that one of the most important things for anybody and everybody is that the medical practitioners data bank does get open to the public. It's essential. You can find out more about the vacuum cleaner you're buying than you can about the doctor you're going to see.
I'm going to jump in on that, because let me try to explain what the data bank does. In 1990 is when we started collecting data under the data bank, and all it collects are the payments made by insurance companies or disciplinary actions by hospitals against physicians. And so these are actions that have occurred in the past. There are 46,000 right now reported claims in the data bank. What it tells you is if some malpractice carrier has paid money on behalf of a physician, and it's no limit. So if they pay $5 or $500 million, the name goes in the data bank.
But it also tells if doctors have been reprimanded or suspended by hospitals. If there's a 30-day suspension,
The public has a right to know that.
The public certainly has a right to know about their physician, and if they go to the local law offices there in their community, if they go to the courthouse and look to see if there are currently actions pending against this physician, they're going to determine if presently there's something going on.
Well, you know, also,
medical malpractice cases take 2 to 4 years.
I think also what's
jurisdictions.
important, as we do with most things in our lives, is we talk to each other. Everybody in the community makes a phone call to a friend or a family, and we look out for each other. My next guest, in fact, says that each of us has the responsibility to be in control of our own health care. He says what do you call it? Patient power is what he calls it. He says we are the ones who must bear this responsibility because we are the ones who will ultimately live with the consequences. I'd like you to welcome Wesley J. Smith. He's the author of a book entitled Getting the Best from Your Doctor. How do you find this out? We've talked about this database that we can't look into, so what can we do?
Well, there are a lot of things you can do. First of all, I've been listening to all of these horrific horror stories, but let's realize that most doctors aren't butchers like we've heard about today. The problem is when you look at a doctor, you can't tell whether that's one of the butchers or whether that's one of the good physicians working very hard to help his or her patients.
So what can we do?
You ask questions and you keep notes, write down what the doctor tells you. Miscommunication, as Jim was saying earlier, is a very serious problem. Let me give you an example. Don't say, "Are you a specialist?" Because an obstetrician can say, as we've heard, "I'm a specialist in plastic surgery." You say, "Are you board certified?" Learn the words of art that they will then have to answer and not be able to weasel out.
Board certified. See,
Board certified. Are you board certified, and in what are you board certified?
Some other top questions. Come on, give
All
us
right. Secondly, if you've been told you need surgery, where can I get a second opinion? If you're in a non-emergency situation and you go in for surgery without a second opinion, you may be hurting yourself. Look at all the unnecessary hysterectomies that are done.
Absolutely.
and most insurances may not cover that without a second opinion as well.
That's my second point.
That's all right. Share it with us. You've done your research.
Well, only because that's exactly true. And most insurance companies will say, "I'm sorry, we'll hold payment on the claim, even if it's emergency."
I know this lady had a good question during the break. What was it?
I'd like to know, say if there's a medical emergency and you're rushed to a hospital and you have to go into surgery, how do you know that doctor is competent that that's gonna perform on you?
That's
There's no
right.
time to
That's
ask
a very
questions.
important question.
Sure.
And you won't have the time to do that, and the hospital will assign a doctor to do that for you. Therefore, it's really incumbent that hospitals only have doctors who are really good physicians. The data bank is important, I think, in that because it can put pressure on these hospitals. But each and every one of you should have somebody who you love and trust and have their name and phone number in your wallet, a patient representative, a patient advocate, sign a durable power of attorney for health care, who can then come in and make those kinds of decisions for you and ask the kinds of questions you would ask, but that you can't ask for yourself.
I think a lot of families are going to have a good sit down after this show and just get that in order. We're going to be right back after this. You were giving such great information before. What are some other things, some of the most important things that we should keep in mind, particularly in emergency situations, as we were talking about earlier?
Well, when you're going to be assigned to a hospital by a doctor, make sure it's not just because his medical office is across the street. When you're talking to a doctor and asking to determine whether or not he's going to be your doctor or she's going to be your doctor, ask how many hospitals in this community do you have staff privileges on? And use these terms of art like staff privileges. Because if a doctor can't get on staff on more than 1 or 2 hospitals, there may be a problem that you need to check out. Ask the doctor, what kind of continuing education do you get to keep up with the continuing changes in medicine? Spend more time interviewing a doctor and looking for medical care than you do buying a stereo. Because too many people say, oh, he's a doctor. I can't possibly talk to a doctor. He's got a Mercedes-Benz, I have a Chevrolet.
That's one of the biggest mistakes that we make.
Well, the reason he has the Mercedes-Benz is because you've been paying him through your health insurance.
Hello.
You are the consumer.
That's right.
And it's
Also,
time for
Rolanda?
people to realize that doctors have to be accountable just as lawyers do and JCPenney does.
Ralph in Capitol Hill.
I was going to say, many people like those good people in your audience who were victims of malpractice or the parents are banding together now in a group called the National Patient Rights Association, run by Laura Whitkin, who's a victim of malpractice but a marvelous fighter for these hundreds of thousands of Americans. And it's located in New York City. And Congressman Jerry Nadler has introduced the key bill here called the Health Quality Act of 1994. And just write your member of Congress and ask for the Nadler bill on health quality. And that's to crack down on bad doctors and bad hospitals and give the American people out there some assurance and information and choice for competence instead of incompetence or sometimes criminal doctor behavior.
As Wesley calls it, patient power. We'll be right back. This is one of those kind of shows where when it's over, sit down with your family and get this together in case you find yourself in a difficult situation medically. Before we end, Mary and Tom, why don't you share some good news with us?
No, I don't think I can. No, no, about halfway through the hearings, we found out that my wife was pregnant.
And they have a beautiful baby.
And we have a son. He's a 1.5 years old, Jordan Thomas.
All right, good. Thanks so much for being with us. We'll see you next time on Rolonda.